Have you missed your period for like 3 months going to 6 months and you checked you are not pregnant? You are worried you want to get your periods back. Do well to listen to this video till the end. You might learn one or two things from here. Absence of period is medically known as amenorrhea, or you can call it mixed period or no period. It is known as amenorrhea. Amenorrhea is classified into two. We have the primary amenorrhea, we have the secondary amenorrhea. The primary amenorrhea is a situation whereby a young girl has gotten to the age of menarche, but she has not seen her period for the first time. Whereas secondary amenorrhea is a situation whereby you have been getting your periods all of a sudden for like 3 months, the period got missing, you have not seen it, or you have an irregular period for like 6 months. That period has not come even at all for like 6 months interval. Now, it is known as secondary amenorrhea. Now, for the purpose of this video, I'm going to be focusing mainly on secondary amenorrhea. Now, there are some natural reasons why you should not see your periods. One is during pregnancy. It is normal that when you are pregnant, you are not supposed to see any form of blood. Now, number two is during breastfeeding. For some women, it is normal that when they are breastfeeding, they will not see their period. Number three is during menopause. It is normal that after menopause, your period will cease. And lastly, if you have a surgery to remove your ovary or uterus. Some common causes of this secondary amenorrhea include: one, your birth control methods, such as the injectables, the pills, the IUCDs. Remember, the side effects of these hormonal medications is mixed period or no period. Now, even when you withdraw from them, some of the side effects takes time to leave your body. Like your body will take time to recover how to menstruate again, how to ovulate again, and all that. So when you are making your decisions on the type of contraceptive to use, bear this in mind, guys. Another reason is when you have a previous uterine surgery, such as D&C, dilatation and curettage. Now, another thing that can cause secondary amenorrhea is when you are on chemotherapy or radiation therapy for cancer. It can alter your hormones. Now, another reason can be poor nutrition. It can be stress. Very important. Like, guys, you need to bear this in mind, that stress is one of the commonest causes of secondary amenorrhea. So it is very important for everyone to manage their stress. Now, haven't mentioned some of the commonest causes. Let's look at some medical conditions that can cause secondary amenorrhea. Number one is primary ovarian insufficiency. Wait, let me break it down. This is a situation whereby either the ovary stopped working before the age of 40 years. It can cause you secondary amenorrhea. Number two medical condition is hypothalamic amenorrhea. It is a situation whereby there is a problem in the hypothalamus. Remember, the hypothalamus is part of the brain that controls, or that is responsible for releasing of hormones that controls the activities of the ovaries and the uterus. Now, another medical condition is pituitary disorder. This is a situation whereby there is excessive production of prolactin. Prolactin is responsible for producing of breast milk. So when there is excessive production of that prolactin, it will result to production of breast milk, and this will alter your periods. It will cause secondary amenorrhea. Another medical condition that can cause secondary amenorrhea is hormonal imbalance, just as in PCOS, in hypothyroidism, adrenal disorders. Now, you might be asking, what can we do in order to resolve this? Before I go right into that, or before I give you one bonus tip, there is one important, like I have tested it and proved it. Before I tell you that, if you have not subscribed to my YouTube channel, please do use this opportunity. I'm begging you to subscribe. It's free. Hit that subscribe button. And if you're watching me from Facebook, do well to follow me in order to be getting my contents every time I upload them. Now, here are some of the things you need to do in order to get your periods back. Remember, if the reason for your mixed period is because of pregnancy, maybe because of breastfeeding, menopause, or maybe you have a surgery to remove your womb, to remove your ovaries, there is nothing we can do about that. I'm sorry to disappoint you. There is nothing we can do. Now, if it is because of many other reasons, maybe if it is a medical condition, please, guys, I'm begging you, talk to a doctor. Go, make sure you assess yourself. that there is no any underlying medical condition. If there is any, please do well to manage it properly. Visit your healthcare providers in order to manage it properly. Now, number one tip I'll be giving you today is to handle your diet. We are what we eat. Like, I have a video explaining some of the food you need to eat during your periods and some food you need to avoid during your periods. Do well to watch out for that video. Now, another tip is to exercise regularly. It is very important, especially if the cause of your secondary amenorrhea is because of maybe birth control, stress, and the rest of them. Exercise will help with it. Very important. I know a lot of people, they might say, all these doctors and nurses, they keep saying exercise. We can only say it. We cannot do the exercise for you. It is your choice either to do the exercise or not to do it. Now, another tip I'll be giving to you today is to manage your stress. Guys, it is very important. You can do this either through yoga, time management, reducing your workload, or even hanging out with friends. You can do those hobbies you love. It can help. Another tip I'll be giving you today is supplements, guys. Now, it is very foolish of you to think that you can get all the vitamins and minerals your body need from just food. It is very important that when you get to the age of 30, it is good for you to add supplements into your daily routines. Supplements like calcium, vitamin D, vitamin E, or even Prime Rose. There is this new product now called Prime Rose. Go and get it, guys. It is very important, especially if you are above the age of 30. Get these supplements, have them in your cupboard so that you will help yourself. Now, the last but not the least tip I'll be giving you today, this one is very important. Like, open your ears very wide. Now, I tried this and it worked for me. This thing is massaging your lower abdomen with castor oil. I don't know if you people have seen this viral video of one lady who is teaching about castor oil, the use of castor oil pack at the lower abdomen. Guys, I gave this a try and it worked for me, and I have recommended it for several other people and it worked for them. Just give it a try. You come and thank me later. So for now, I think that is all. If you have learned anything from this video, do well to share out the video so that other people will get to see it. And bye. See you next time.